This vote, the yeas are 219, the nays are 213. The resolution is adopted. Without objection, the motion to reconsider is laid on the table.
Mr. Speaker, pursuant to House Resolution 566, I call up the bill H.R. 1 with the Senate amendment thereto, and I have a motion at the desk.
The clerk will report the title of the bill, designate the Senate amendment, and designate the motion.
H.R. 1, an act to provide for reconciliation pursuant to Title II of House Concurrent Resolution 14.
Mr. Speaker, today we're considering H.R. 1, the One Big Beautiful Bill Act, is passed by the Senate. This bill creates the right incentives for historic economic growth, makes unprecedented investments in our military and border security, and implements the largest spending reduction in American history by twofold, alongside other generational fiscal reforms.
The bill still kicks 17 million Americans off their health care. Record cuts to Medicaid, record cuts to the Affordable Care Act, record cuts to Medicare. But that's not all. 4.5 million kicked off nutrition assistance, mostly seniors and children. Why? To help subsidize massive tax cuts that mostly go to the top 1%.
The One Big Beautiful Bill ushers in the golden age of America, as our great president says, where taxpayers, not illegal immigrants, are put first. It eliminates tax on tips and overtime and brings tax relief to seniors. It saves, it sustains Medicaid, and it's there for those who truly need it.
That tax cuts are expenditures. They're the biggest spending in this bill, to the tune of $5 trillion. $5 trillion added to the national debt to give tax cuts to the wealthiest people in the country at the expense of feeding our children, health care for our people.
Watching this vote, and you can say billionaires all day long, but you know what the new tax cuts in this bill are? Because there are new tax cuts. For the waiter and waitress who's working maybe 2-3 shifts at a restaurant, at a diner, barely getting by. That's the new tax cut that we're putting in this bill. And so you would say, well, then how could the other side possibly vote against that? But, Mr. Speaker, they are. And maybe a focus group told them that if they curse enough and if they say billionaires enough, those families will forget what's actually happening. But they're not going to forget because they're paying attention.
This bill represents the largest cut to health care in American history. It's an all-out assault on the health care of the American people, an assault on Medicaid, an assault on Medicare, an assault on the Children's Health Insurance Program, an assault on the Affordable Care Act, an assault on Planned Parenthood and the health care of women all across the United States of America, an unprecedented assault on the American people and their health care.
Leaders recognized.